Good afternoon, Dr. Amal Louis. I'm from Astor Hospital in Dubai. Basically, I was in UK for many years, nearly 15 years I was practicing in UK, and then I went to India for a few years, then came to Dubai around same time last year. The striking thing I noticed as soon as I started intervention is the age group of the patients, especially the expats that we see in our center. I mean, we probably do one of the highest volumes among the private sector in this part of the world, and almost more than 90% of the patients are the sort of predominantly are South Asians. Um, we started a cath lab around, first, to be honest, I'm not showing any complicated case. It's probably more about some complicated population that we have. So I hope it's going to be interesting and will raise some discussion. So we started a cath lab around July last year. I joined Astor around December time. So we've already done, I mean, the first year, so we did more than 1,000, I mean, to be more precise, about 1,100 coronary angiographies with about 576 PCI. And we do see a lot of STEMI as well. We've done at least 278 STEMI in the first year. And as soon as I saw that, I started like a registry and started maintaining the data of these patients. And all these patients we enrolled into cath lab registry. The majority of patients, I'll show you the age group and the ethnicity, are South Asian expats, predominantly Indian nationals, Pakistanis, Bangladeshis, and so on. And we basically reported all the patients' angiography report, and we specifically analyzed the STEMI and the PCI patients, and we found out some very interesting data. As I said, the total number of patients are studied by 1,146, and among them, at least more than with the 85% had significant CAD. STEMI were about 30% of the angiograms that we do, and about PCI of 62% of these patients underwent PCI. Primary PCI, I mean, it seems to be a major work in our hospital, and about 240 of these patients underwent primary PCI. And you can see almost 85% of the work that we do are STEMIs and STEMIs. So unlike a majority of the centers where it's usually around 50 to 60% acute and remaining of a stable angina or elective. So majority of the work is emergencies and for ACS and STEMIs. We do use a lot of FFR. IVIS we try to use whenever possible, when the insurance permits. Once again, a lot of these patients belong to the middle or the low-end insurance group, so sometimes convincing the insurance for IVIS and higher technologies proves to be challenging. We have done a few orbital atherectomy, and I would say for the amount of acute work we do, the mortality is relatively less at 1.5%. So that's as far as the profile of the patient and the work we do in our center. You can see this again is unique. 95% of the patients we see are males, I mean, because they're all expats coming here for work, so we don't see many female patients. And the age distribution is what was quite striking. I mean, I'm sure people who worked in the western part of the world, we know the average age group of these patients is between the 60 to 70. They're present with MI, and the South Asian have been in India, it's usually 50 to 60. But whereas here, the curve is shifting towards the left. We see more in the 40s, and you can see almost 180 of the, which is nearly 20% are in the 30s. So that was the most alarming thing that I noticed when I came there. That's the reason I want to present this. How do we deal with such young patients having such extensive disease? Do we apply the standard guidelines for them? And these unique patients, they have unique risk factors. So how do we treat these patients? That's probably my primary point of discussion today. And once again, as I say, among the patients who had CAD, you can see still the average age group is less than 50, and the significant amount of patients are in the 30s in our center. The nationality, the majority are Indians. I mean, we are strange. We actually in Dubai, we're a center, we don't get any local patients at all. I mean, you can see about 42 are from the Middle East and North Africa. Majority are from Egypt and Oman and places like that. So, but the top three, I would say, are the patients we cater to. And once again, I don't think anywhere in the world we get the mix of Indians and Pakistanis, Bangladeshis to the amount that we get. So that's why I thought this data was interesting because of the type of South Asian populations we get. So as I said, a lot of the patients are, sorry about that number, I think it's about 415 end-STEMI patients. and you get a significant amount of STEMI and some stable angina as well. In terms of risk factors, pretty much the same, about 50% hypertension, almost 50% and diabetes. But dyslipidemia, we didn't find that much on these young patients, strangely, about 25% dyslipidemia. LV function, majority were normal, about, I would say, 30% had a significant LV dysfunction. And another interesting thing you can see that nearly 23% of the CAD patients had triple vessel disease. I mean, these are the patients we're talking the 30s with triple vessel disease, extensive triple vessel disease, and equally they had single and double vessel disease. Among the angiogram we did, only 17% were actually a normal angiogram. So the majority had significant CAD when they come to us at such young age group. Well, more than 50% had PCI and few had CABG. We don't have CABG in our centers yet, so currently they've been referred to other centers for CABG. And the PCI, the majority once again single vessel. We do quite a lot of multi-vessel PCI too whenever it's indicated. It's about the treatment. I'm sorry, I'm going back. Yeah, let's say PCI. So I mentioned about the overall type of patient that we see. They're much younger patients with much extensive disease. What about the STEMI patients that we see? Once again, you can see that a lot of patients in the 30s and 40s. The average age is 47. We have the minimum age of 23. So what is happening to these patients? We just wonder, if any particular, I suppose it has to be the lifestyle, apart from the conventional risk factors. What is actually causing them to present so early, and how do we stop it? That is the discussion. The nationality is pretty much the same, South Asian populations. The comorbidity, again, the incidence of diabetes is around 45%, hypertension 40%. Once again, dyslipidemia, we didn't see that much in these young patients, which was strange. We expected to be much more than that. And in terms of LV dysfunction, I think a third of them had significant LV dysfunction. You can see, at least a quarter of them had at least moderate to severe LV dysfunction as presentation as well. So they're not only young, they not only have extensive coronary artery disease, they also have significant LV dysfunction when we present to us. The STEMI treatment majority underwent primary PCI, and you can see almost, apart from 8%, it's almost, I would say 90% underwent primary PCI. A small portion was referred for surgery after they recovered from the STEMI. What about the PCI subgroup? The pattern is very much the same. Again, it's the only patients are getting younger. The average age group is at 48. Once again, significant number in the 30s, patients who we do PCI amongst. And the nationalities, once again, the distribution is pretty much the same. And again, we noticed, the diabetes, hypertension around 45%, but dyslipidemia is, again, not as much this population. And almost 50% of these patients had significant LV dysfunction among the patients we do PCI on. So we looked at this particular population. It's a Bangladeshi population I found was very particular in this group. We compared that, and you can see the average age is younger, at least 5 years younger than the other South Asians that we see. And you can see a third of them came to us at triple vessel disease. So 1 in 3 patients who came in with chest pain had triple vessel disease. So it was quite alarming to see such extensive disease in such a young age group in the South Asian population, especially living in this part of the world. So what we find from our preliminary data is the CAD is quite prevalent among the South Asian expats in the UAE. And these expats appear to develop CAD at a much younger age group in this part of the world. And 70% of these patients you should present as an acute event, NSTEMI or STEMI, unlike we see in other places where a lot of them get a positive TMT and so on. The incidence of CAD is high among the South Asian expats between the 30 to 40 years of age. Almost 15% of the CAD patients are in this age group. And 28% of these patients had triple vessel disease overall. And it was also alarming to see that almost 20% of these patients had no risk factors whatsoever. There's no diabetes, nothing. So why are they getting, such extensive disease? It's actually puzzling, really. So there are other risk factors. I don't know. Lifestyle. I mean, I'm sure lifestyle diet plays a major role, but still, why to get it in the 30s? So I think that is the data we wanted to show. And if there's anything, I mean, how do you deal with these patients? I mean, we have these patients, 30-year-olds coming with triple vessel disease day in and day out, and these are all patients who live here. They don't have a family here and abroad. I mean, do you do CABG for them? I mean, which means that literally they have to pack up and go back because the job is almost gone. And most employers don't employ them back after CABG. So do we just go ahead and send them on? I mean, how do we treat these extensive young expats with triple vessel disease? I mean, that's the take-home message I want people to think about. And if you can come up with any suggestions for us to manage these patients, and and also for the insurance is a huge burden on the insurance. I mean, these guys, some of them just pay like a 500 dirhams per year for insurance, and they come up when we spend put 3 stents and use IVs and this and that, and cost 100,000 for the insurance. The insurance are repeatedly questioning us, why are you guys doing this and doing so many angios? I mean, we have to. If they come with an NSTEMI or a STEMI, you have to treat them. So I think with that I stop and talk, and happy to take some questions.